I'm Alexis Scott, your neighborhood news reporter at the Nueces County Courthouse. County commissioners voted to table their decision to choose a new health provider after discussions of splitting with the city of Corpus Christi. Last November, Nueces County commissioners voted to part ways with the Corpus Christi Nueces County Public Health District.
I'd like to make a motion that the county change directions and withdraw from the city county health district in order to focus on our rural public health services outside the city limits, which we are committed to serve.
That departure was delayed this week as Corpus Christi City Manager Peter Zanoni appealed to the court, saying the city was not ready to split with more than 24 jobs on the line, advising there be a 1-year extension before making the final decision.
We're here today to say we don't think we're ready. We don't think we're ready yet. It's very complex to separate the models in terms of making sure both sides are ready to provide service in a new way, different than what we've been doing in the 30 years.
The city and county were initially discussing an agreement with Amistad Community Health Center at the Calderon building in Robstown. The agreement was set for 5 years, but instead a 3-year agreement was proposed. The other concern with moving forward too fast was the possibility of losing critical state grants and other funding from the U.S. Department of Health and Human Services.
We have to be clear. We have to do the right thing. We have to know what we're doing. We have to know the cost. I asked those questions about the grants. How are we dividing those up? I know the state had asked us for the last postponement because they weren't clear how we were going to separate those and move forward.
Several county commissioners believe waiting another year could put a burden on the most vulnerable communities that are underserved.
We got an extension twice. I don't think it's fair for the community in the western area, Nueces County, that doesn't get served and can't come in to the health district to be left out again. And it's a shame on us here, and if we don't care.
We weren't getting enough county services in the outlying areas, and that is still an issue that we absolutely have to address.
I do believe strongly in the concept of this. I do believe that this will serve many underserved in our community, but also to sever a partnership that we've had for so long, and the fact that the city manager is here today asking for further discussion, that goes a long way in my book.
Plans are on pause until the city and county can figure out how to effectively separate. In your neighborhood, Alexis Scott, Chris 6 News.